Part 2 of the Tight Back Fix has a surprising tip that will have you moving with greater ease. This exercise tip is especially good for pregnant mamas with tight backs, but because of their growing bellies, cannot stretch as they did before. It is very gentle, and because the Minimax supports the expectant mother in the semi-recumbent position, can be done safely and effectively into the later stages of pregnancy. And because the spine is maintained straight throughout, it can help people with surgical fusions feel less tight and restrictive. But always consult your doctor to make sure this exercise tip is appropriate for you. Once again, your superpower, your breath, is the foundation of this exercise. But we will now start to activate the psoas, otherwise known as the hip flexor, in order to achieve these remarkable results. And this is because the diaphragm and the hip flexor attach to the low back vertebra. This is my client. She's in her 3rd trimester. She will inhale on the pauses, exhale with movement of the legs. So here she's exhaling. Inhale, she stays. Exhale, she'll slide that leg to straight, and inhale, she'll reset. These changes occurred within 5 minutes. The breakthrough concept to immediately increase back flexibility is to gently activate deep postural muscles which attach to the spine. Once again, these muscles are the diaphragm and psoas. Some breathing tips to get the most release. Inhale through your nose. It works your diaphragm better. Make sure your breath goes down. You'd be surprised to know how many people take their air up into their chest versus taking the air down into their rib cage. A smaller inhale is recommended and is easier to direct. Exhale through your mouth. Place the Minimax on slant up against a wall or against the headboard of your bed. This exercise will require patience because the movement of the legs occur only on exhales. This will slow your breathing and give you time for your inhales and exhales. The semi-recumbent heel slide can be done alternating legs or more effectively if both legs are flexed up. Exhale, slide one leg to the bent position. Inhale, stay. Exhale, slide the other to match. Try to maintain tension in your abdominals even on your inhales. It's like you're breathing under an abdominal brace. This will make it more difficult to take the air down, so make it tiny. Test your forward bend before and after you do 5 to 10 repetitions of the semi-recumbent heel slide. You should notice a big improvement. Some words of advice from Joseph Pilates. Above all, learn how to breathe properly. Change happens through movement. You are as young as your spine is flexible. Please spread the word about Hooked on Pilates and the Minimax.